Hello and welcome to Pace Hospital's podcast. Today, we are diving into a growing concern in the fitness world, that is, the impact of gym supplement protein on kidney health. With the rise of protein shakes, powders, and high protein diets, many fitness enthusiasts are unknowingly putting strain on a vital organ, the kidneys. Today, we are diving into a growing concern in the fitness world, that is, the impact of gym supplement protein on kidney health. With the rise of protein shakes, powders, and high protein diets, many fitness enthusiasts are unknowingly putting strain on a vital organ, the kidneys. To guide us through this important conversation, we are joined by Dr. Kishore Kumar, consultant nephrologist and kidney transplant physician at Pace Hospitals. With his vast experience in kidney health, Dr. Kishore will help us understand how excessive protein intake, especially through supplements, can affect the kidney function, who is at risk, and how to use supplements responsibly. Dr. Kishore Kumar, thank you for joining us at Pace Hospital's High-Tech City. Let's start by understanding how do the kidneys work in people who go to the gym.
Hello, my name is Dr. Kishore Kumar. I am working as a consultant nephrologist and kidney transplant physician at Pace Hospital's High-Tech City. Today I'll be discussing about kidney problems which can occur in people who go to gym. So before discussing about this topic, I want to give a brief information about how our kidneys work. So we have two kidneys in our body. Each kidney has 10 lakh small units which are called as nephrons. These are the functioning units of the kidney. In these units, the blood will come and it will get filtered and urine is formed. If we take a nephron, it has two parts. One is a glomerulus, which is a globular round structure, and there is a tubule which is connected to that glomerulus. So first, the blood will come to that glomerulus through a small artery which is a tube, and it will go away through a small vein, that is also a small tube. So once inside the glomerulus, the blood is filtered, and the filtered blood leads to formation of urine, and that urine is passed into the tubule, and from that tubule the urine travels through the ureter, it will come to the bladder, and from there it will go out. So this is the normal routine functioning of the kidney.
Dr. Kishore Kumar, what problems can occur in people who go to the gym?
Usually people who go to gym take many supplements, like they take whey protein supplements, or they take creatine supplements, or they take some steroids, or they can take some vitamin injections. So I'll be discussing about the risks in relation to kidney with these supplements. First we'll discuss about the whey protein supplements. So normally, what is whey? So I'll discuss about how this whey protein is made. So if you take cow milk, out of 100 ml, 3.4 grams of protein is there in the cow milk. Out of this 3.4 grams protein, 80% is insoluble protein which is called as casein, and 20% is soluble protein which is called as whey. So the milk which is taken from cow, there is one enzyme which is added to that milk. After the addition of this enzyme, the insoluble and the soluble proteins get separated. So the insoluble protein will form coagulum, and from this coagulum the cheese is made. The soluble, the remnant, which is the liquid whey, in that liquid whey there is whey protein, along with that there is some bacteria and also fat. So this all bacteria and fat is removed via membrane filtration, and after that the liquid which is remaining is dried, and after that from that dried liquid the protein is made, that is the whey protein. So if we take the whey protein is also of different types: whey protein isolate, whey protein concentrate, whey protein hydrolyzed whey protein. In these varieties of whey protein composition is different. Sometimes the protein composition can be 95 to 99% in one type, and in the other forms it can be little lesser, and the other additional components of the protein will be different among these different types of products. So how much protein is required for a normal person? If we take a normal person, around 0.8 to 1 gram per kg per day is required. So for example, in a 60 kilos person, around 50 to 60 grams of protein is required per day. The protein can be animal protein or veg protein or any type of protein. Per day it is 0.8 to 1 gram per kg per day. This is the normal protein intake. But if we take more than 1.2 gram per kg per day, that is called as high protein intake. So people who go to gym, they are given this whey protein supplements, or they are advised to take more amount of protein in other forms also, and they end up taking high protein diet. So with high protein diet, what is the benefit? So it is proven beyond doubt that whey protein supplements improve muscle strength, improve the recovery from exercise, and it will also lead to increased performance.
So doctor, what can happen inside the kidney if we take whey protein or a high protein diet?
What can happen inside the kidney if we take this whey protein or high protein diet? So what will happen is, if we take protein has to be metabolized or broken down in the body to be used. So after inside the body, the protein, after it gets broken down into amino acids, the waste and once it is metabolized in the body, nitrogenous waste products are formed. Urea is one of the nitrogenous waste products out of many nitrogenous waste products. All these waste products have to be eliminated from the body via kidneys. So whenever we take high protein diet, there is increased blood supply into the kidney, especially into the glomerulus. The tube which I have already mentioned, the artery, will get dilated and more amount of blood will come into the glomerulus. So if there is more blood inside the glomerulus, the pressure inside the glomerulus will increase and it will lead to intraglomerular hypertension and increased filtration of the blood. This is called as hyperfiltration. And along with that, high protein intake can also cause increased acid generation in the body, increased phosphorus level, and it can also cause increased inflammation. So you may ask me, so you are telling all these side effects, so is there any proof of harm in patients who are taking high protein diet? Are there any studies done? Yes. So there are studies done in these patients with high protein diet or high protein intake, especially the gym protein, whey protein supplements. So I'll be telling about the results. So the studies are of two types: the studies which are done in normal subjects, studies which are done in patients who already have a compromised kidney. So compromised kidney can be like single kidney, people who have donated their kidney, or who are born with one kidney, or whose kidney is removed because of some problem like cancer or stone or some other condition, or whose kidneys are not well, means they are suffering from chronic kidney disease, or if they have diabetes leading to kidney damage, or if they are losing protein in the urine. These are the people who have compromised kidneys. So in patients who are healthy subjects, like people who have normal kidneys, two kidneys, and they don't have any other issues, in these patients the studies were done, especially after whey protein intake. These people were observed for around 6 months to 1 year, or maximum up to 2 years. There are observational studies, there are trials also. Out of in all these studies, there is no clear-cut harm to kidneys in these patients if they are taken for 6 months or up to 1 year. But there is a definite proof that intraglomerular hypertension and hyperfiltration definitely occurs in these patients. So the problem with these studies in patients with healthy subjects is that we don't have a follow-up of more than 6 months to 1 year. It means that what happens to these patients because of that hyperfiltration beyond 1 year, or if they are followed for 4 or 5 years, what happens to them? We don't have any information. But based on the studies which we have till now, there is no clear-cut harm in healthy subjects on taking high protein, high amount of whey proteins. But if we come to the other group, especially in patients who, in people who have a compromised kidney or single kidney, or whose kidneys are already damaged, there is a definite harm. The harm in the form of worsening of kidney function or new onset kidney damage, because already if a person has a single kidney or a compromised kidney, their kidneys are working more. If we give them more amount of protein in their diet, the kidneys have to work even more and they get damaged early. So we avoid high protein intake in patients with a compromised kidney, or who have a small kidney or a single kidney, or if they are born with a single kidney, or if a person who has donated his kidney, or with a CKD patient, or someone losing protein in the urine. One more issue with whey protein is there is also a definite proof that whey protein intake increases pressure inside the glomerulus or the kidneys, increases filtration, but it also increases the calcium excretion in the urine, and it will also decrease the pH of the urine. It means it makes the urine more acidic. So increased calcium excretion in the urine along with less pH of the urine, this is a recipe for kidney stone formation. So there is a risk of kidney stone with high whey protein intake, and people who already suffer from kidney stones, whey protein intake, high amount of whey protein intake can also can also lead to increased risk of stones. So this is about the whey protein supplements in people who go to gym.
Could you explain what problems can be caused by creatine supplements?
So you must have heard about creatinine. Creatinine is a test which we do to check our kidney function. This is a blood test. So how is this creatinine formed inside the body? So we will know about it. So creatinine is formed inside the muscle. So first what will happen is there are two sources of creatine. I am speaking about creatine. Creatine is converted to creatinine inside the muscle. So creatine, there are two sources of creatine. One is liver or kidney inside the body, or from the supplements which we take from outside. So creatine which is formed inside the body or which is taken from outside is transferred to the muscle in the body. In the muscle, that creatine is converted to creatine phosphate, and it is useful for the functioning of the muscle. And gradually this creatine is converted to creatinine and it is excreted outside the body through the kidneys.
So doctor, what is the benefit of creatine supplements?
So what is the benefit of this creatine supplements? So creatine supplements are usually advised to people to be taken, the people who go to gym, they take creatine supplements. For first 5 days they take 20 grams per day, and after that 3 to 5 grams per day is advised to be taken. So creatine supplements improves the strength, improves the muscle size, and also it will improve the performance. It is proven that creatine supplements will improve all this.
Can you explain what is the risk of taking creatine supplements?
But what is the risk of taking these supplements, especially in relation to kidneys? So there are reports that creatine supplements can lead to allergic reaction inside the kidney, which we call as allergic interstitial nephritis. Sometimes the creatine supplements can also cause tubular damage, which is called as acute tubular necrosis. These are all just case reports or reports. It doesn't mean that these side effects happen to every person who take these supplements. There are reports of occurrence of these side effects in patients who take creatine supplements. So you have to be aware of the symptoms of kidney damage, like swelling of the feet, sudden weakness, decreased urine output. All these symptoms, if you develop, or if the high blood pressure, if you have a sudden increase in blood pressure, all these suggests that kidney is damaged. So whenever you are taking these supplements and if you have any symptoms or new onset symptom, it is better to get your kidneys checked.
Dr. Kishore Kumar, what problems can steroids cause?
Steroids, the anabolic steroids, these are injections which are taken inside the which are given intramuscularly. There are different types of steroids. One is like testosterone, dihydrotestosterone, nandrolone. These are all synthetic anabolic steroids. They improve the muscle size, they also decrease the fat, and they will increase the strength. But they have lots of side effects, like liver related side effects, heart related side effects, or kidney related side effects. If you take the kidneys, like creatine supplements, they can also cause allergic reactions inside the kidney, they can also cause tubular damage, and they can also cause scarring inside the kidneys. These are the side effects of anabolic steroids. So it is better to avoid anabolic steroids if you are going to gym, because they are definitely proven to be harmful for kidneys, for liver, and also for heart.
So doctor, what are the vitamin supplements?
Vitamin supplements are vitamin A, D, E are sometimes injected intramuscularly in these people who go to gym. The basic vitamin A, D, E injection is commonly used for animals to treat their vitamin deficiencies, but the oily component of that injection is used in the people who go to gym to increase the size of the muscle. Basically, that oily component of that injection will cause allergic reaction and it will lead to water accumulation in the muscle, so that leads to increase in size of the muscle. So to bulk up, in people who go to gym for bodybuilding, these injections are given. But the problem is, along with that oily substance, vitamin A and D also along with E is injected. This vitamin A and D will cause high calcium levels in the body. These high calcium levels have to go out of the body through kidneys. So in the kidneys, they will lead to kidney stones, calcium deposition inside the kidney issue, which is called as nephrocalcinosis, and it can lead to permanent kidney failure. So it is better not to take these vitamin injections also, especially which contain vitamin A, D and E in high doses. Now coming to other type of problems which can develop in these patients, which is called as I'll be speaking about exertional rhabdomyolysis. Rhabdomyolysis is a condition where the muscle gets broken down due to excess use of the muscles. So people who go to gym, for the first few days they do exercises, or they get strained more than what is required, because of which the cell wall of the muscle cells it is broken down, and the protein which is present inside the muscle cells will leak into the blood, especially the myoglobin which is present inside the muscles will leak into the blood, and this protein can damage the kidneys. So these people can have sore muscles or sudden onset weakness or red colored urine. So if you develop any such symptoms while you are going to gym, it is better to come to hospital immediately and get your kidneys checked, because it is a treatable condition. Now one more type of problem which can develop in these patients is hyponatremia. So while we do exercises, or if we go to marathons or excessive exercise or running, we sweat a lot. So sweat contains, along with water, there is more amount of sodium chloride also, salt also. So body will lose more amount of sodium if you sweat more. But to cover up that dehydration, we usually sometimes take only plain water. So if you take only plain water without electrolytes or without sodium or chloride in it, that can lead to less sodium in the blood, which is called as hyponatremia. So whenever you are excessively sweating, or if you are getting dehydrated while you are working out or running, it is better to take electrolyte water, so that you will replenish your electrolytes also inside the blood. So this is in short about the problems which can develop in patients who go to gym, especially in relation to whey protein intake, creatine supplements, steroid supplements, or vitamin supplements.
Thank you, Dr. Kishore Kumar, for shedding light on the impact of gym supplements and high protein intake on kidney health. Your insights have helped our listeners understand the balance between fitness goals and long-term well-being. If you have any concerns about how supplements or dietary protein might be affecting your kidneys, don't hesitate to consult a nephrologist. Remember, maintaining kidney health is just as important as building muscle. Early awareness, regular checkups, and professional guidance can protect your kidneys and overall health in the long run. We'll be back soon with another episode on Pace Hospital's podcast. Until next time, stay informed, stay smart, and take care of your health.